Hi, I'm Nikki Deasy. I'm the college tutor at Eastbourne, and Chris Scanlon is my counterpart at the Conquest Hospital in Hastings. We have about 20 consultants on each site, intensivists on each site as well, and with a few staff grades also. There's approximately 11 registrars and about the same number of SHOs, and you'll spend 6 months at Hastings and 6 months at Eastbourne and swap at the midpoint. The hospitals are split mostly between a hot and a cold site. Eastbourne is a mostly elective hospital. There is some operating out of hours, but most of the emergency operating is done in Hastings, which is CPOD and also trauma. Both the registrars and the SHOs will spend 6 months at each site. At Eastbourne we offer things like major urology, major gynaecology, ENT, a bit of paediatrics and elective orthopaedics. So a lot of your workplace-based assessments can be covered and modules completed within for the elective work at Eastbourne. When you move to the Conquest, you can cover a lot of your emergency surgery, so that's where you'll do your trauma, CPODs and major laparotomies. Most of the general surgery is done, also elective general surgery is done at the Conquest Hospital, and the labour ward is a busy labour ward of about 3,500 deliveries. And that's covered by a registrar of a night. We also have elective caesarean section lists every day that's covered by a consultant, and a consultant anaesthetist is present on labour ward from until 5 o'clock every day also, so there's masses of training opportunities there for that.
Hi, I'm Sarah. I'm one of the Anaesthetics CT2s and I'm currently based at Eastbourne but have been at Conquest for the last 6 months. On anaesthetics, so on my normal 8 till 6 job, I'll come in about 8 o'clock and pre-assess the patient. So I go first to theatre, get changed and then get my list for the day. We have an app on our phones which tells us our rota, so I know what list I'm with and what boss I'm with. And then I usually go, so at Eastbourne there's an admissions ward where we all go and we pre-assess all the patients for the day. And usually you meet the boss on the ward and you sort of divvy up the patients, or if you're there before your boss, you see the patients and you go and see the patients, you tell them what they can expect from an anaesthetic point of view, you read through their notes, make sure that they're fit for surgery on the day, that they've got all the investigations that they need.
Once we've seen the patients and pre-assessment, we then go around to theatres, then have about a half an hour period where we're beginning to get some of our medications ready for the anaesthetic, preparing our equipment, meeting the surgical and theatre team for the day, and doing a briefing that we do every morning before all the patients come in. The operating list then starts at about 9 o'clock in the morning, and we go through the day, and there's a morning and afternoon sort of schedule, whether we see our patients all the way through the day, or maybe you'll be moved to a different list for the afternoon to see something a little bit different. So as a CT1 at Eastbourne and Hastings, we have a fantastic on-call situation, which I think is very rare across the whole of the UK, in that we do no evenings and we also do no nights for the whole of the CT1 year. We do 1 weekend on call every 4 weeks, and that's switched between working at Hastings, where we do the emergency theatre list for the weekend, or at Eastbourne, where we're covering any sort of emergency work, but also on the intensive care unit.
This is the intensive care unit at Eastbourne. It's an 8-bedded unit with 2 side rooms. As one of the CT1s, you'll do 3 months here or at Hastings doing your intensive care block, or you'll be here every 4 weeks on the weekend to do your on-calls. If you're one of the CT2s, you'll do all your intensive care over at Hastings doing your on-calls there, and if you're one of the registrars, you'll be here on and off for your on-call days.
I think it's an amazing setup for 1 year in your life as a doctor. You're not having to do nights and weekends and on-call, lots and lots of out of hours working. And the benefit of that is that we then spend a lot of time in theatre through the week. So as a core trainee in Eastbourne and Hastings, your numbers of cases that you manage to achieve by the end of the year are way above your colleagues around the country.
So my on-call is based at the Conquest site, and I'm based mainly on the intensive care unit there. So we've got a 6-bedded ITU and a 5-bedded HDU there, and our on-call start at 8 AM or 8 PM, depending on whether you're doing a day or a night shift. You go, you hand over, you get a handover from the outgoing team, and then you cover intensive care. Out of hours at Conquest, there's myself and a registrar, and we cover obstetrics and intensive care. CPOD, so the emergency theatre, if any CPOD cases need to be done, then depending on the time of day, usually we would pre-assess the patient whilst we wait for the consultant to come in, and the consultant covers CPOD out of hours.
In Eastbourne, the on-call largely covers the intensive care unit. Occasional operating goes on, emergency operating, that's mostly urology or ENT at Eastbourne. So that will be done depending on the skill mix on the day, whether it'll be the consultant or one of the trainees. But basically we work as a team at Eastbourne out of hours. Most of the out of hours work will be seeing referrals from the ward, referrals from A&E, and mostly with regard to intensive care admission. The setup is slightly different at Conquest. So there's an SHO that covers, that's normally the CT2 level, that covers intensive care. The registrar will cover labour ward, and then there are 2 consultants that are on call there. There's one that covers intensive care and then one that covers theatres. So there is more out of hours operating that goes on at Conquest, so major laparotomies, that sort of thing, and that can go on through the night, and that's often a consultant-led service. Weekends again are slightly different. There's trauma lists on both days at the weekend, plus the emergency CPOD, so actually there's an awful lot of consultants around at weekends. You'll find that there's a consultant for the trauma list, a consultant covering the CPOD list, and then a consultant on intensive care, so there's an awful lot of support. At the Conquest Hospital, where you may be doing labour ward, if labour ward is quiet, there's opportunities for you to come up to theatre if you find you're not getting enough emergency surgery exposure. You can do big cases with consultants there, or by yourself with them if you wanted to. You could hold the obstetric bleep, so it is quite a fluid arrangement. You can sort of change it so you can get the best out of it, really.
The teaching we get at Eastbourne and Hastings as anaesthetic trainees here is fantastic. Every Friday morning we have a whole Friday morning dedicated to teaching. We're taken off the rota. It starts a little bit later in the morning than your usual early start, and it's consultant led every week with one trainee getting involved. It's really high quality teaching, and every 4 weeks or so we do simulation.
We focus that mainly at the Eastbourne site, so everyone comes to Eastbourne for Friday morning teaching. We've had fantastic feedback from that, really, and we get large numbers of people, so about 10 or so trainees can come to that. Really great feedback from the trainees and from the consultants. A different consultant will take it each week, and then one trainee is assigned to run it with the consultant. A mixture of topics, so basic physiology up to obstetrics, intensive care topics, and then once a month the teaching is a simulation based, and that alternates between Conquest and Eastbourne.
From a point of view of your anaesthetic training, there's so much to sign off within the first 2 years, all of your competencies, all of the different modules that we have to do, and because you spend so much time in theatres day to day, you've just got to be very proactive in getting them done, and hopefully by the end actually of doing a year in Eastbourne or Hastings where you don't have all that on-call commitment, you can get quite a lot of your portfolio completed here before you move on to your CT2 job.
We encourage everyone to complete an audit or a quality improvement project. We have our, I think it's bi-monthly clinical governance meetings, and trainees are encouraged to get involved in those. Present cases that they've had, present audits. We
all have to produce a quality improvement project by the time we've finished our year's rotation here, and produce a poster and present that. Although I've heard good feedback from the whole sort of deanery education sort of team, that we're one of the few places that do that, which means that a lot of people get good posters done, and it's a tick thing that you have to get done throughout your 2 years.
What we've sort of set up over the last couple of years is that the point where you change hospitals at 6 months, the college tutors send out forms to the consultants that you've been working with and ask them to make comments, give you feedback, sort of more specific, and then we also ask you to comment or give feedback on the consultants, because we know it's a two-way street, and that really helps us as well to know how we can adjust our teaching or our style of training to maximum benefit for you. At the Friday morning teaching sessions, we also ask you to give written feedback for that, and it's all anonymised as well. So I think that's what sometimes people feel, that they can't give a true representation for fear of you know, being found out, for example. But everything's anonymised, so it's quite an open way of doing it. If you've taken part in that feedback, I'll then compile the feedback, and if, for example, if you've taken part in the tutorial, I'll compile the feedback and send that back to you, and again, that's something that you can keep and put in your portfolio for future.
As a core trainee, I'm on my normal day-to-day job. I'm paired with a consultant every day, a consultant or a staff grade. So they're the people that I'm working with one-on-one, and that's the nice thing about anaesthetics. You do have one-on-one consultants that you're working with every day. Obviously the surgeon's very important, and then the theatre staff and your ODP. So the anaesthetic consultant and your ODP, so your operating department practitioner, are the key people for me, because they're the people that I work with in the anaesthetic room, and then they're the people that I'm directly working with throughout the day.
The ODPs, especially I think as a CT1 starting out, are your third hand. They're so knowledgeable, some of them. They've seen and experienced things for years and years and years, and will always be there to hand you that thing you hadn't thought of at that moment when you're beginning to get in a bit of difficulty, give you a bit of reassurance, or sort of be a second person to sort of speak to and say, you know, I think I'm getting into a bit of concern now, can we go get the boss, who will never be far away.
Hello, I'm Sylvie Harris. I'm the matron on ITU. You can find me Monday to Friday in my office, and you'll be working on the units with the nurses in charge, who are the people to go to with all your questions.
Hi, I'm Cheryl Sparks. I'm the lead nurse for the critical care outreach team. We cross both sites, Hastings and Eastbourne. There's an outreach nurse on duty 24/7, so all shifts are covered day and night. We follow up patients who have left intensive care to make sure their recovery is ongoing. And we also see sick, deteriorating patients out on the wards, intervening where we can to prevent admission to ITU. You'll be working with us with both sets of those patients, either coming into the unit or leaving the unit.
All our rotas run through an app which is called CLW Rota that everyone gets put onto. It's a great app. You can see where everyone is for the day, what rota your sort of list and thing you're going to be on, and you book leave through that app. It's really, really simple. That then goes to either Sue in Eastbourne or Jana in Conquest.
Hi, my name's Sue. I'm the office manager here in Anaesthetics, and along with my colleague Leanne, we take care of all the administration in the department. So if you've got any questions about your theatre rota, your on-call rota, booking leave of any kind, just come along and find us.
I've got a logbook for all of the cases that I use. I use Medberry, but there's also a Royal College of Anaesthetists logbook. It's essentially just to document all of the cases that you do. You have to have a logbook of every single case that you do, so that you can go to your ARCP, so your assessment at the end of each year, and prove that you've done enough work and enough competencies.
Also the iResus app is quite good for emergencies. Algorithms are there, there's drug doses, and there's a variety of other different med calculators and things that I'm sure you will have come across. We're all on a WhatsApp group. It's quite useful for arranging swaps. I'm sure you've done it before. Quite a lot of us live over in Brighton, so we socialise over there, and there's also a group that live in Hastings, but I think we're quite good at getting out and seeing each other outside of work as well.
Yeah, it's been good. 6 months at Conquest I've enjoyed. So I was at Brighton for 2 years before that, so Conquest is a smaller hospital, but it means that you know all the bosses, which is nice.
It's been really friendly, really nice, very supportive. I've never felt out of my depth or unsafe, and yeah, it's a really nice team to work with.
We look forward to seeing you shortly, and hope that you'll enjoy your time at East Sussex. There's loads of training opportunities for you here, and we're all very approachable and open, and willing to help as much as you can to get the best out of your training.